There are so many fantastic chemical peels out to treat photoaging skin. You can choose some that has no downtime whatsoever, so there's no flaking, no peeling, or nothing visible that you can see. Or you can go for the stronger ones that work deeper in the skin. It's got a different mechanism of action that will cause downtime. Most of the peels, the downtime is anything from 5 to 10 days. So the peels I love to use in my skin clinic is a combination of hydroxy acid, so alpha and beta hydroxy acids. So it is a glycolic acid, a lactic acid, and a salicylic acid blended together. It's a quick 30-minute treatment, no downtime, very cost effective. Another acid that I absolutely love is called TCA, or trichloroacetic acid. This little guy will cause visible peeling, but I love it because it comes in a variety of strengths and you can decide how deep you want to go. You could, for instance, treat, let's say, the neck more aggressively because you've got more aging there, or the chest area, and then be lighter, or more gentle rather on the face. So I love that because you can really play around with that. Just a little side note here, hydroxy acid peels normally are time dependent. The longer they stay on the skin, the deeper they're going to work. Whereas a TCA, or trichloroacetic acid peel, is layer dependent and strength dependent. So you choose like a 12%, a 15, an 18, a 20, a 25, a 30, and you decide how many layers you're going to put on the skin. Then there is one peel that for me is the absolute ultimate that I do on my own skin at least once a year. And it's a combination of glycolic acid, trichloroacetic acid, and phenol. Now when you go for those type of peels, which are pretty much a medium depth peel, and some TCAs can also fall into the medium depth peel category, please make sure that you go to a very well experienced, very good qualified aesthetic professional, whether it be an aesthetic professional like a therapist that works with a doctor, the nurse that works with a doctor, or of course an aesthetic doctor or doctor that focuses and really specializes in aesthetics on the skin itself. Don't go to someone that's not properly trained. And not all peels are equal. Peels, some of them don't work very deep, others work very deep. If you want to really see a big change in your skin, I recommend that you go to an aesthetic professional, because they are able to use acids that can be used or applied on the skin at a lower pH than in a normal standard beauty salon, but they can also of course use something that's much stronger. Key thing afterwards is to look after your skin. Follow what your professional tells you to do. It is so important, because if you don't follow step by step, you can cause problems on your skin, whether it be to lead to hyperpigmentation, sensitivity, dehydration. But in actual fact, you could also not give your skin the right tools or ingredients it needs to repair itself, and therefore you're not going to get the best results. But great treatments. I love chemical peels. It's something that I love to do, something that's changed my skin, and it is amazing for photo aging.